Once again, welcome to ORTC 2024. Myself, Dr. B.V.S. Ganeshawara. It gives me immense pleasure to be with you all once again. First of all, I must thank Dr. Kalathia for giving me this wonderful chance to share my experiences and my viewpoints with you all. So, as a part of this year's sessions, we have been focused on the case taking and theme methodologies and all. So as far as the case taking and all the methodologies are concerned, my colleagues already given a vast amount of information to you all, especially likes of Dr. Kalathia, Dr. Manoj sir, and the rest of the people. That was very extensive. So I'm not going to go with all that information once again. Just I would like to make it a lighter note so that I would like to give you some salient points about all these things. And finally, I'm going to present my case. Many a times,
share your screen.
Yeah, I'm doing. Okay.
No, screen is not there.
Just a minute. Okay, now it is. Is it okay?
Yeah.
So, in generally homeopathic practice, many a times we encounter the freshers, new practitioners, even at times the seasoned practitioner also, in a given case, which approach to be taken to go with the case. Even at times I also get confused about some cases. Earlier it was much more, but little bit okay now. They say it is the patient who decides which approach to be taken for the case, given case. Because we have a maze of understandings, maze of systems have been practiced by far, like right from the beginning of Dr. Kent, and then likes of Boningason, and then sensation method approach recently, and Sagers, and nowadays it's Dr. Gandhi's approach and all. With the maze of symptomatology, with the maze of information, and with maze of ideologies, we get confused which one to take up. But what I understood is during the case taking itself, if you have all the information with you, the concrete information, you keep on doing the things very casually, like learning initial driving and practicing, and then driving with much ease later on, right? So even today's case also, which I'm going to present at the end of my descriptions, will tell you why I'm saying this. So to get the confusion to clarity, generally I get many questions about the homeopathic study and find that there are distinct differences in learning homeopathy and becoming a homeopath, right? They are really two different ballgames. So let me explain this. In most of the homeopathic schools, what happens is the courses we have been taught the homeopathic philosophy, repertorization, materia medica, and all these things. So these courses will give you the homeopathic student much information, mostly from books only. So these courses will give the homeopathic student, especially the course designed, like much information possible about common remedies and the philosophy of Kent and Hahnemann and Stuart Close, like this. So this is really kind of reinforced by taking exams that giving gradations and multiple choice questions and essays to determine if you are really have the understanding of the subject in hand or not. But I feel this is a kind of learning through books and getting grades is a kind of linear thing because it relies on memorization and deductive reason to pass the test. Of course, a good student may be able to excel in such examinations and environment to get perfect grades. And then, after successfully passing the all the examinations and courses, they may be able to see a case in a supervised capacity. But what I understood is the best way is training, not teaching. Because the way is to learn by example and experience. There is a big difference because teaching and training are different volumes, as I said. Because learning from a book is a didactic way and is flat and leaves much of the imagination while learning about the remedies. But primary remedies, understanding is what asking to be healed in any given case. So this is not generally comes very easy for most of the people. It is one thing to understand the symptoms to be able to translate them into our repertory. It is another task entirely to see the core of a person and determine what is asking to be healed. So most people will give their test or case testimony in a very verbose and convoluted way. So it takes a great practice to stay clear and find the patterns of their suffering. So this cannot be learned from the book. Am I clear? So if you have any doubts, you can ask me. So for any given richness of any case is held in words and descriptions as well as how a person gesticulates. The stories that they tell will always be where the true understanding of the case. Getting to this understanding requires great clarity of homeopathy. So in the beginning of learning case receiving, most of the students become very overwhelmed. The most common mistake is to project their own experiences, what we call the prejudice. So we must always understand what is asking to be healed before we can find any remedy for the person. So this process of learning to listen and find the thread of a given case in front of a live person or a video is the best way, I would say. Recently, I was going through Dr. Kalathia's live cases. That was a very good opportunity for me. The way he used to take the cases and the way he used to evaluate, the way he used to confirm the things, that can be only by learned by watching the cases only and expect doing the things. So this process of learning to listen and find the thread of the case only be learned in front of a live session only. So it is a process that a student or a homeopath needs much practice most of the time. Unfortunately, it cannot be learned from a paper case because paper cases are many a times two-dimensional. They do not have the feeling that alive cases can have. Because sitting in front of a client is the only way to really become established as a homeopath. In my opinion, a student homeopath should not be encouraged to practice without supervision until and unless he goes through at least 100 cases with an expert supervision. So learning from live cases and follow-ups will also bring practical aspects of philosophy to life. And uh, organon is the best understood when it is supported in real cases and real people. Many times we go through organon uh, in a vernacular way. That will not help much, because when you see the cases from the perspective of organon, then only you'll be able to understand what really organon meant to be. So one can learn by doing only. So to be a homeopath, it requires confidence. So every client who sits before a homeopath knows innately whether the homeopath has confidence or not. Many times you might have also experienced, even the experience of homeopath also at times. In order to get the confidence, one must need to have sat before clients many a times. They learn how to control their own emotions during the case taking and how to handle themselves when the case does not flow, and we get emotional. And when we get emotional, we end up giving our own medicine to the patient. They can be very present and not caught in sympathy. Instead, empathy is the best way, because sympathy will ruin a very good case also. There is no way a homeopath in sympathy can really see a clarity in a given case. They are too involved in their own experience of the cases to see their client clearly. So as I said, empathy is the better emotion to feel in a given a case. So it is more so in being empathized, you will get more detached and still with much caring. And homeopath will not go to suffering themselves or to understand the person. So when a homeopath does his cases with empathy, he will not go with the prejudice most of the times. But prejudice always follows in a subtle way. No two people ever suffer exactly same. So we tend to get match our present case with the older cases we have gone through. Oh, this might be this might be this. But you can make a note of it, but just leave it that way. So protect ourselves from being prejudiced and being caught in prejudice. You have to detach yourself. This is the basic in any given case. And each homeopathic student will eventually come to this and many other challenges when finally starting seeing clients. Those have generally seen many clients, they will be more experienced, can detach themselves and go with the case with much ease. And once you, as a student, if you have the experience of going through such expertise with seeing the cases with experts many a times, you will get much confidence to go through your cases when you do the things on your own. So as far as case taking is concerned, as I said, uh, Dr. Kalathia and Dr. Manoj sir given very good understanding about that. I'm going to give you just some salient points of case taking to be taken care of. Because case taking is not a normal conversation between two people. It is much more, because we are going to see or experience the core of the person. So we as homeopaths need to be the listener and just receive the information our patient giving us. This is a simple task, sounds like, but in its simplicity, it is very difficult, because we have our own program that is judging and analyzing all the time. Our own program, always judging, analyzing the whole time, and we try to hear what we want to, and we disastrously end up giving our own medicine many a times, or keeping the view of the past experiences. Oh, it might be pulsatilla, so let us do pulsatilla, like this. So when we think of a remedy, it is so difficult that the conversation, what we hear, the information in a way that convinces us if the remedy we want to prescribe. Oh, this could be this could be this. That is why Dr. Vithalkas once said, whenever he was thinking of a certain remedy, he always tried to prove himself wrong. This is not right. Time and again, he thoroughly explored all the information that which did not fit to his description. And that is his success. Because case taking is all about understanding our patient, not about finding the remedy. Many a times while taking the case, right from the beginning of the description of the patient, we try to match whatever the patient giving. We try to find some keynotes, or some repeated rubrics, or some themes. Oh, this could be like this could be like this. So don't do that. Just try to understand the patient, and even do not try to understand. Just take the information, whatever comes. Because when we understand really the deepest core of a given case, the remedy will present itself. So don't do anything. Don't want anything. Just be present in an active process like meditation. So being completely in the now, observing the process taking place in your patient in front of you without judgment, an open, loving heart, an open space, and be a blank field. Keep your completely blank. Initially, it will be very difficult, but with practice, it comes gradually. Even for a seasoned or experienced homeopathic, it comes out, but we have to make a note of it and just keep it over there. Let us say whether it matches with that or not in lab. So it will help the patient to reveal their innermost core. So apart from the case taking, apart from the narration of the patient, we all have our inner program. We as our therapists cannot shut it off, right? Every time it comes out. But we need to know our own program and just be with all our own stuff in a silent witnessing process. Just as we are there in a witnessing way for the patient. That is why Dr. Ananda Jain says, in order to heal, we have to feel. So be silent, just ask, tell some more. tell some more. This is the best question. Or else you can say, I didn't get you. It helps a lot because we don't need every detail of their life. Many a times we may feel that we have to take each and every detail of their life patterns and all. Because while asking that way, at times patient may get hurt or may not be able to give you the information in detail. Because we have to we don't have to go for each and every detail. We have to get the core only. To get the core, whatever the information the patient gives in importance, that will lead. So it is important to be silent or just ask, tell more. Okay? So which will help our patient to go deeper and deeper into their experience. We don't need to know every detail, as I say. So every case is a new experience. Every case, each and every patient will tell their story, their narration in their own way. Some start with symptoms, some start with emotions, some start
हाँ
with pictures and so on.
हाँ हाँ हो गया चल चालू हो गया अच्छा
Hello? Yes. So when listening to our patient, it is important to not to get caught in the story of this patient or life. We have to see with a bird's eye view. Listen what has been spontaneously mentioned. The gestures, the hand gestures, the eye movement, the facial expressions, especially, are very underlining and undercurrently the most tell you the most important issues which needs to be explored. So we don't analyze or theorize what is important in a given case. It is the patient who will guide with their own non-human specifics. Uh, a helpful technique is to let the patient connect to where they feel the distress in their body and let it come again and again and probe deep onto it, and that makes easier for the patient. At times, even looking in the eyes of our patients can also distract or disturb. So many a times, don't try to straight away look to the patient. Just look at sideways and look at your system or computer, whatever you are working with, and you can observe. That comes with experience many a times. So this is all about some soft hints about case taking, and then the stuff comes about to the case analysis. To me, I feel it's a kind of movie editing. Once the movie is in your hands in a raw form, it is the time to make a good and perfect edit. What to keep and what to discard. Actually, the answer always in a good case take lies in good case taking only. Once you understand the person sitting in front of you, it becomes easy for you to go through if you are diligent enough. Take all the salient points, analyze the information coming from the homeopathic consultation, and how to synthesize this outcome into a homeopathic prescription. Mm. And then the insight into how to make a prognosis considering like what is to be treated in a given pathology, the condition of defense mechanism and the patient's level of health, because it helps in making the choice of potency, right? Which potency to be taken care of in a given medicine. Because even though if you select correct medicine, if your potency selection is wrong, the case gets spoiled. and possible causative and diseasing maintaining factors to consider, the patient's personal and family medical history, where the uh, issue of nodules also comes out. And recently, you might have gone through lot many cases, especially the people who have gone through the uh, COVID vaccination. Lot many complaints they are coming up. You have to consider that issue very much. Almost after COVID, whenever I see cases, especially pathological cases comes out, they are associated most of the time with COVID vaccination only. All the cases, most of the time, they are aggravated or started after COVID vaccination. And to see the clarity of the remedy pattern. So these are all information that enables you to better estimate the duration and complexity of the treatment. So the skills to judge the symptoms present in the case with regard to the peculiarity and find the distinction symptoms of the case. And the skills to judge the symptoms presented in the case with regard, as I said. And a well-structured schedule that can be used to assist you at giving a homeopathic prescription and enabling the patient to go through a fast and accurate recovery. So one can differentiate the appropriate remedies and select the similar one from your repertory analysis and or thematic analysis, whatever you are doing in a given case. So knowledge as to how to differentiate the appropriate remedies and the guidelines which will enable you to select the right potency with which to start the treatment. So recently, about case taking, Dr. Shekhar Algunde sir came up with a very nice book. One can go with that to understand the different steps of case taking, especially. It's very nicely mentioned. And after that, the group themes. These are all the recent developments in our homeopathic understanding, apart from the keynotes, repertorization, and all. Of course, the group themes are always there, but they are not completely developed. Even in older times, that Kent also at times considered the group themes. You can go through the literature when you, if you go through the lesser writings of the Kent, you can understand it, and some other literature also. So, what is group themes? It is really an attempt to identify the mechanism for understanding groups of the related remedies according to the natural classification of various sources used as therapeutic substances in homeopathic practice. So group analysis not only offers new aspects to well-known remedies, but also eliminates the smaller or less or well-known remedies as well, resulting in a more comprehensive and balanced understanding of the materia medica. For example, in anacardiaceae, we have most known remedies like anacardium and rostox. Apart from that, for a fresher, it will be a little bit difficult to understand the idea of rus blah blah, rus radicans and all. So if we have this theme and group ideas, it will get a little bit better or easier to understand. Many a times in skin cases, we end up with rostox if it is an anacardiaceae case. But there are some remedies like rus radicans, rus venenata. They help very much better than at times like of rus tox. So there, this group theme helps in a much better way. And then comes kingdom things. This is also very well explained by our seniors, our colleagues. I'm going to give a little bit my sharings only. So when we listen to a case, everything a person says, every gestures they make, including what they wear, will be an expression of their vital force. If we are unprejudiced observers, we can then see the language of the person's disease. The language will many a times tell us quickly from which kingdom the disease resides. Hmm. We can sometimes quickly discern whether the best remedy will be from the animal kingdom or plant kingdom or mineral kingdom. So if we are clear about all these things and the metaphors of the disease within the appropriate kingdom, we can often make our remedy selection much easier. Because say, with the understanding of all these group themes, you have done your case with repertorization and you understood that this case falls in mineral kingdom. You can leave all the plant and animal remedies and focus on mineral kingdom. It reduces the sets much easier or makes it much easier, right? For that, we need to have some general guidelines. I would like to give you some of them. Of course, already you have it. So as far as mineral kingdom is concerned, so minerals are generally dictated by physics and chemistry and are defined by the periodic table of elements. All minerals are made up of one or a combination of the remedies, either the creation of a structure or of loss of structure. So a person needing a mineral remedy will tell story of their disease in relation to the structure in their life and the need to create it, maintain it, or about its loss. This often appears within relationships either familial, intimate, or occupational. It can be at the level of personal, familial community, or in a bigger worldview. The periodic table is a map of all the elements. It is a relationship between all of these elements and make up the physical structure of all these things on earth. To be matter of fact, entire universe. It is also about the beginning to the end of the time in a physical matter. It also correlates the structure of our life from beginning to the end. So by understanding the rows and columns of the tables, especially if it is a row and the different positions across the rows, we can understand themes and individual placements of each element and how that is representative of a human living condition. So to have a better understanding for a practitioner, I would suggest go through the literature of Dr. Jan Scholten and Dr. Rajan Sankarans and Dr. Joshi's books. They're very well explained. And then comes the plant kingdom. See, I'm doing the things in a sequential way because everything, the way how it started from Darwin's theory, right? Because there was nothing earlier. Then all started with minerals. Then slowly the living things like plant kingdom started, and then progress to animals. So as we spoke, as we discussed that it is about structure for minerals, and then when it comes to the plant, it is about the sensitivity. So this can be expressed in many ways, like the lack of sensitivity or expression or overreaction or hypersensitive or reactivity. Because plants cannot move, so their experience is one being sensitive to their external environment. So because of this, they need to adapt ways to survive. So considering the natural history of botanical information we have about plants, it helps us to understanding their ways of adapting. So for example, plants are thrive in the desert. They have ability to hold water. So in the absence of water, they shrivel and contract. Right? In the presence of water, they expand. That is the idea of cactaceae. Okay? So to understand the plant kingdom, Dr. Shankaran's books will help you. And the source information, especially, you can get from France Vermeulen's literature. It's a very good idea to go through France Vermeulen's literature. And recently, they came up with Dr. Franz Vermeulen and Linda Johnson came out 4 volumes of large volumes of plants, but of course they are not. They may not be available to or accessible to most of the people. But the Prisma and Synoptic, they have very nice information about the source information and the mythological ways and the alkaloid information about the plants, very well described. And then about animal kingdom. Animals is all about survival, either killing or being killed. So it is the threat of being hurt or hurting of another that is the root basis of most of the animal behaviors, as you know. So when a person speaks their story, they need an animal remedy. They will often speak to the energy of the animal and the natural behaviors. So they will tell of particular stories that correlate to the themes that of animal naturally expresses. Mm. Like the lachesis will express in a dual way, right? And then they will tell the particular stories that correlate especially. We have remedies from animals like mammals, reptiles, insects, birds, and creatures from the sea. Because if each and everybody, each and every substance, each and every animal, they have their own story to tell. But something that is common to all of them is comparison to another and competition with the struggle for survival. This is the basis. So if we find the theme in any of your case, you should consider some animal remedy. This is a basic idea of whatever has been told by far. I'm just making a gist only. So each of the kingdoms has its own story to tell, just as each person has their own story to tell. Right? By understanding the kingdoms better, we can understand materia medica better and be better prescribers. So there is always some order in physical universe. It has been described in many ways in each of the kingdoms. Uh, the beauty of homeopathy is that we use the order in exact and extract with vital energetic essence when they are of similar vibrational essence. That is what we call similia, right? So understanding each kingdom will help to narrow our focus on remedies in a fair, quick way and exact way when we truly understand what is asking to be healed in a given individual. So this is about all about kingdoms and all. And as far as the repertory is concerned, everything has been most of the times well described. So I'm going to give you a small hints about repertory skills. Just Okay, I will show something to understand. The idea of combining rubrics, because in a given case, for example, if a patient tells you that or you found that the patient lacks confidence, so let us see that. So want of self confidence, this is the rubric. Okay, so we have 391 remedies in this rubric. So maybe or may not be, the drug might not be in the given 391 remedies for the patient, because there are more similar rubrics. See, ailments from embarrassment, cowardice, opinion without courage. So these are all the uh, cross references we have to consider. So how to do that? Okay, so this is I am showing in my repertory chart. You can do it with your own repertory charts or in a other way also. But this is a simple way I'm trying to show to make you aware. So to make it combine, just now say we have 391 remedies for want of self-confidence, and we combine all these cross references. It extended to 958 remedies. So this is an idea of making grand generalization so that you will not miss out your remedy. To make it uh, much easier, I will show you something, because these repertories are nowadays available in all the softwares, and most of the times I believe those who are practicing with the sensation method and the repertorization method are having the softwares with you all. So if you have that, so this is one repertory which helps you a lot. It can help a lot. So for example, ambition rubric is there. Ambition quality you can take. For example, ambition increased if we see 189 remedies. And with the base of symptoms, with the base of understanding, at times we may miss out the given remedy in this. So what we can do is, if you go with this repertory, you can expand your remedies like 227. So there should be a more chance to not to miss your given remedy. So this is one idea. And then to use repertory in a logical way also helps. So recently, I was going through a injury case, injury in elbow. It got separated. Just I would like to show from my case. Yeah. So this was the case in elbow injury happened. Just to show you how can we deal with the repertory in a convincing way. So it was separated like anything in 2 days. So I have given the calendula, hypericum and all, but that doesn't help her. So finally, what I did was, earlier I used to give her lachesis for her ailments. I searched whether the injury has got or suppression has got anything to do with lachesis or not. See, injuries won't separate. We have lachesis here. Only one dose I have prescribed. I never imagined, actually, by far in my 30 years of practice, I never prescribed lachesis for an injury patient, especially suppurative cases like this. So, in a span of 36 hours, total injury got dissolved. Let me see whether I can show. Yes. See, this was the suppurated wound. And after 2 days of giving lachesis 201 cases, she could able to move her hand very easily, completely dissolved. So just to show you, okay. So these are some hints I would like to wanted to present you. And now I'm going to go with my case. It's a case of breast cancer. So she is 82 years old, a widow. Actually, my colleague referred her case to me in April 2023. There is a gradual hardening and swelling in left breast since January 2020. So there is no pain or any marked changes in the activity levels in first 2 years of except the growth of the lump only. So gradually she started declining. And she's not ready to undergo any allopathic treatment or any kind of treatment, to be matter of fact. Not even ready to undergo further investigations either. So very much loathing. So not much of information available from her, as she is not ready to speak to anyone, even to me also. So whatever the information I had from her relatives, especially from my colleague, her son got departed from her after death of her husband. So after death of her husband, daughter-in-law took all the jewelry and properties by manipulating her. And since then she felt betrayed. And nowadays she stays with her daughters because her son got completely disappeared from her, almost like. So this had most deep impact upon her. But she never told to even her daughters also. She just kept mourning only. Even several times they tried to contact her son to visit her, but he refused to. So this was the ultrasound done in favor of multicentric left malignant lesions breast. Let me say I can. Yeah, ultrasound findings favor multicentric left breast malignant lesions, axillary lymphadenopathy, and so there has been biopsy also. So this is the biopsy done, not biopsy. This is a cancer markers test. See, the basic limit is less than 30, it was 47 by that time. It was on April 15, 2023. So in these type of cases, as I said, whatever we have explained, the thematic prescriptions, the most of the repertorial analysis will not help at that time, because in one-sided diseases you have to take a very different approaches. So that is what I mean to say in my starting of my lecture. You have to ready for the outcomes at times, to think in a out of the box way. So they generally in these type of cases, many a times I would like to go with the organopathic remedies, right? Organopathic remedies means, let me show you. The organopathic remedies are based on Burnett's indications. If you study Burnett cases about the malignance, you will get much better information. They might be very helpful to you to deal with these type of cases. So in this case, what I did, because nothing was available to go with, so simple organ remedies, breast cancer, these are the remedies I had. Bellis, perconium, helonius, and so on. And then I did some repertory analysis also. Breast cancer, contusion from injury caused by. Here, injury I considered in with the terms of her emotional injury, right? Death of loved ones. Of course, in real, there was no death of her son, but it's almost like that. So that was I considered. And also, she is very much indifferent to whatever happens. So when I did that, bellies were come very strongly. So if you can go to the Burnett's description about mammary tumors in belly spare, large inflamed patches shows themselves, right? So here the criteria comes which potency to be prescribed. Belly spare mother tincture. Because in these cases, you can't give higher potencies. Lower potencies, especially mother tinctures, 3, 6 will help much better. So belly spare 30 given per day, 10 drops at bedtime. So the prescription given on 15th 4 2023, on 2020 14th November, this is the status. So with the structure like this, we had symptoms like fever with chills and pain on touch and pressure, severe burning pains, stitching pains, loss of appetite with nausea, restless and tossing, and also moaning. Now once again I repertorized. This was the outcome. And here arsenicum album and carboanimal strongly came out, and then followed by coname. So here I am not going to consider the kingdom analysis and all. Just go with the whatever the things are coming up strongly. And here arsenicum's album 6 has been prescribed. And they say don't ever try to prescribe arsenicum album lower potencies, especially it may cause hazardous results. But here I did that. So in plussing method, it is given a plussing method 3 times a day. And then this is on 23rd November 2023, started discharging. And then 25th November, this is the state. And then 29th November, and it is on 3rd December. And then 10th December. Just you can see gradually changes happening. But you have to be very patient in these cases, especially in these one-sided disease cases. Now, the offensive discharges followed a gradual reduction of the size, gradually appetite improved, but there is severe irritability happening. Even there was no strength to walk, completely and kind of worn out. Severe dyspnea and palpitation started. Once again, this is the repatriation chart I had. Cachexia emaciation with cancer ulceration. So 3 remedies strongly came up: hydrostasis, carboanalysis, congrando. And here, keeping the view of the distress condition and the dyspneic condition, the respiratory complaints and all the thing, palpitation consideration, I prescribed carboanalysis, even though the hydrostasis and congrando also indicated hydrostasis came up very strongly, but I considered carboanalysis. Why it is? It is suitable for old persons, feeble constitution, those persons whose vitality becomes low on account of some serious or deep-seated disease condition or loss of fluids. So here also carboanalysis 6 prescribed on 10th December, daily 1 dose, once again in flushing method at bedtime. This is on 11th January 2024. And then we have made out the report again. See, the cancer marker test, which used to be more than 45, came down to 5. And then the ultrasound. Before to that, there was a strong confirmative of malignancy. Now, ultrasounding find mark. There is a query only. So, and also, patient is doing much better. The energy levels improved, everything is improved. So, my friends, this is all I can say. So, if you have any questions or queries, let me know. Hello?
Yes. Anyone have any question? You can ask.
Yes, sir. So one doubt regarding rubric selection, sir.
Yeah.
Sir, you have taken cancer, breast, contusion from. What is the meaning exactly?
It is on the basis of injury only. Because injury, from the point of emotional injury point of view, I took the case. So it's a kind of out of the box thinking, I would say. So you have to consider at times. Not
What made us to think about contusion in that case?
actually, yeah. Let me see. Just a moment. Yeah, I'm sorry. Actually, that was wrong rubric. So it was wrongly taken, but the rubric to be considered serious injury caused by. That is the rubric to be taken. And thank you for correcting. Okay.
Okay, thank you, sir.
And anything else anybody would like to ask?
Good evening, sir.
Yeah. Really?
Sir, after such period of time when he was that the cancer was dissolving, so there
Yeah.
was any change in the mental state of the patient
Yes, of
mentally,
course.
where he was
It,
loathing was there.
of course, yes. The loathing was gone. She's more active, and she started traveling also nowadays. She's much better from all walks of life. Actually, I just wanted to present you a video clip of her, but I couldn't get her video. So it's much better from all walks of life. Even her blood sugar came down. Her high blood pressure also came down. She could able to eat whatever she would like to. Everything. Before to that, we had restricted her to stop the what you call the dairy products and the gluten products. Everything we have stopped her. Now she could able to take some tea with milk and all these things, and dietary patterns and everything has been much better and much improved. Yes.
Sir, one more doubt.
Yes, ma'am.
Sir, how to understand that we have to change remedies frequently? I mean, what are the signs that show us
Yes.
to change remedy?
You have to look at it carefully because in Burnet's point of view, if you say, or in these one-sided cases, one cannot say exactly what is to be changed. One thing will help you is the relationship of remedies. I will show you how. Not only in these type of cases, even whatever the case you may go through. So, related to this. Yeah, can you see the screen?
Yes,
Hello?
sir.
Yeah.
Yes, sir.
Now see. So these are the remedies which are complementary to belly spare, right? Or similars. See, if you can see, you have arsenic here. See, this is the one way. I don't say this is the only way, but this is one way you can consider. So you can see the relative remedies of that particular drug and consider. And it should match with the state of the patient. In any given case, it should match with the state of the patient, not blindly. So here, this is the see, belly spare have similar remedies, 18 remedies here mentioned. One of them is arsenic. So after belly spare, I could be able to prescribe arsenic from this point of view also. And in these cases, especially, you need to change your remedy according to need only. And at times you need to change very rapidly also. And the repetition at times you need to make it very frequently. At times you need to repeat even 5 to 10 times a day. Even every like in 15 minutes also you need to change at times in coma cases and all. So these are all one-sided diseases, you know. So in these cases, to understand what is really to be done, you need to see, especially go with the experts' opinion and see the cases with experts. And my advice is read Burnet's literature carefully. You will have most information depicted in Burnet's books. Recently, Dr. Sunirmal Sarkar also came up with much better literature about it. You can have that one also. Some lectures, video lectures are also available. Hello.
Okay, sir. Thank you.
Yeah.